Triage seems to be the area that is the thing that gets jammed up, and we need to turn triage into just that. You arrive at the hospital or the childbirth facility just like you do at a hotel, right? You've already done the pre-check-in, they know you're coming, you've scheduled your Uber, they kind of have a predictability on when you're going to arrive at the hospital. That helps from a capacity standpoint for the department, which is always a problem, being able to predict who's going to show up at your front door. You check in at the front desk, triage, get an assessment. You're either going to a room or you're heading to this lounge, right? That in-between space.
We wanted to really have a human connection in this area, and we designed an early labor lounge. And so what that patient process looks like, they would come into triage, and triage could be directly adjacent to an early labor lounge. And if it was determined that they did not need to be admitted as an inpatient, labor didn't seem particularly imminent at the time, that they could retreat to this space.
So what we've designed here is a standard, or what we would consider a triage room. We did have a chair there, it's gone, so you can't sit any more support person. But we had a chair, we had the bed for the patient. Each of the rooms would have their own attached private bathroom, something that a lot of patients desire. And one of the focal points of our room is our smart board, and you see it in the smart configuration now, but do imagine it as artwork, as a calming, relaxing place for the patient to be. And then you would have the clinician who would come over, be on that side of the patient, thus he or she would have his or her back to the smart board, so he would then focus on the patient and not be focused on the technology. But the nice thing about the smart board is that you can give the patient the information she needs about her care transparently. You can put her fetal heart rate monitor, you can put her medical history, what's going on, you can feed education in there. We have a camera. Again, it's integrating the patient into her care, but being in a functional space so that you can do what you need to do in a triage situation. Remember, this is a triage room, this is not a birthing room. This is designed on the full moon, though. It can serve as anything, but the design really is how do you get people triaged in a human-centric way.